to start presentation. Apa apa? Selamat petang.
Selamat datang.
Oh, I finished. I can go. Oh. I'm not here to teach you anything. I'm not here. I should be standing just across the lane to listen to your clinical practice. But I do have some information that our company has been manufacturing mattresses for 20 years, and we supply our products to the U.S. Fortunately, we get a lot of the feedback from the UK and Australia, and also our base is in Taiwan. So we do like to share some information with you. But we believe that in order to come and say, oh, you should consider this, all that, before that, we believe, basic believe that we should come and listen. We should come and listen to your feedback to understand what is the current practice of you, all the frontliners who are trying to improve the quality of life of patients. So I would like this to be a more interactive session and not this guy who doesn't know much about clinical things to blah, 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 talk. So I'll just spend 10 minutes, less than 10 minutes, just to run through the product. And then I'll ask another question to learn from you. I want to learn how Malaysia hospital, like your hospital, when a patient comes in, how do you take care of patients in terms of monitoring their pressure ulcer status? And when you identify what is the risk assessment tool that you use to update low risk, high risk, and in case of low risk, middle risk, and high risk, what are your solutions? And from there, we come in and say, perhaps we could do this. Then we select the best solution package. Not to buy and sell product. We don't do that. We come and we want to serve. We want to know more. That's why I left my 1-year-old baby in Taiwan, fly over with permission of my wife, say yes, you can go over there for 2 weeks to understand. So I have to make that right. So who can answer me? My first question. Who can answer me? When a patient comes in, what is your practice of identifying pressure sore? What is the practice at this moment in the hospital? Anybody? Mobile. Okay. Yes. So number one consideration is mobility, right? And then the age. Okay. So we got mobility, age, patient diagnosis. Okay. Yes. So mobility factor, age factor, the diagnosis that disease factors. So we got 4 here. So my next question is, what kind of assessment tool do you quantify the risk factor? Like, for example, yeah, this guy is a little bit old, and then, but how do you, is there a quantifying, like, numbers to say what's the score of the pressure ulcer? Is that a common practice here in the hospital? So for example, in UK, in Australia, they use Waterloo. Okay. And then there's in the US, and you follow the Braden. Okay, so Braden is right. Okay. Okay, I got it. So good. So my next question will be, what is your practice when, in case of a patient who is mid to high risk? What is your practice if the patient is mid to high risk? What are your things that you have to turn? Okay. Use little method, and then you have to make sure. Okay, when you turn, how many minutes? Oh, 12 minutes. 2 hours. Okay. Okay. 2 hours turning, 10 minutes. That's crazy. Very tired. So you will consider rhythm matches, and then at least turn once every 2 hours. Right? Anything else? Anything else? Nutrition, right? Because the pressure also is not just by pressure. Nutrition is also very important. Anything else? Back to the block. Yeah, back to the block. Right. Because the bone injection. What if the patient is really high risk, mid to high risk, and how frequent in your database? I know it's kind of difficult to say, but in your estimate, how many percent of patients are low, how many percent are middle, and how many percent are high? Just a rough estimate. Doesn't have to be very precise. Approximately. Yeah, daily or
I put on my scale for on a monthly basis, then
15 to 20%. That is the lowest.
Risk for pressure.
Risk of pressure.
Yeah,
Okay. So 20%. 15 to 20 patients in 1 month that have mid risk or high risk. Like granted
for middle to high risk.
Middle to high risk. So sorry, I have to ask this question. Is that a lot?
No.
That's considered average. Okay. So my next question will be, for the mid to high risk that you have to take care of 20 patients, what kind of ripple mattress do you provide at this moment? This one. So even if the patient is old and then maybe immobilized, and then maybe his nutrition is not well approximately. So you have a mid to high, but due to a lot of certain conditions or restrictions that we can only offer this, right? Well, that is the case in all of the Southeast Asia. It's not just us in Malaysia. It's very common. And we're not saying that it's wrong. No, I'm not saying that's wrong. I'm just saying that there's a risk. There is a risk. I'd like to show you this photo. You can pass from here to all around. There's a risk of using bubble pads because today I'm not here to say, oh, you have to look how good. No, I'm just trying to say that there are different, better equipment for the patient. There is. And when we see when the nurse caregiver has no other option but to offer this, sometimes it really hurts for the patient. Even though sometimes they may not complain, but it really hurts because from that photo, you can see even if the right product, it can cause severe pain and it's very severe. So especially when I look at it, I don't want to say I want to cry, but I just feel sad. Yeah. So that patient. So what I'm trying to say that there is a solution offered, and that's why I'm here, just to give you a solution and to see what kind of thing works for you and what kind of things can work for the patient. I think that's what we're about. We're trying to serve the community, and we have a lot of input from Western countries and Australia, so I would like to share. So first of all, thank you so much for informing that you're using Brandon scale and currently using the advantage of this is obviously it's very affordable, but really when you look at it, the size is only 2.5 inch. So when it comes to, there's not much buffer because according to pressure ulcer, I believe you all know, the 32 mmHg continually for 2 hours, then you'll develop mild ulcer sore. And if the condition is high risk, it goes up very quickly. So with this, it's a good product for temporary uses. But because most of the bubble pads are made of nylon PVC, so nylon PVC is harder comparing to this bladder type. So when you lie on it, the one thing that you'll counter if the patient has able to explain to them it's hard. It's hard. Second thing, the best way is to offer the lowest pressure, but doesn't bottom out, right? You have to offer the lowest pressure, so the interface is less than 32 mmHg, but doesn't hit the hard surface. But for this, because there's only 2.5 inch buffer, there's not much. You have to turn up to make sure it holds, but the pressure is very hard. So that is the consideration here. So when we talk about the solution, we believe that for the tubular one, at least in the US and Malaysia, this offers the more optimal solution for stage 2 and middle risk patients because it alternates every 3 tubes. So you got 3 tubes like this, 3. The first 3 is pillow, so it doesn't alternate. It always sticks on the first 3. So your feet here, feet, and then you lie here, and then you lay across. So every 3 of these, 1 will deflate, 2 will inflate. So every 10 minutes, the other 3, 1 will deflate, 2 will inflate. Because there's more support, so compared to the 2-in-1, this is more stabilized. But because you also alternate, you provide 10 minutes of zero pressure area. So at that time, you can reduce the pressure and still able to manage the pressure distribution. So that is this. And when it comes to the cover, this is a nylon PU, so it is water permeable. It prevents water going in. And also here, we have this laser drill hole. Laser drill. So if you later on, I want you to come close and touch, lie on it. To look at these, there's an individual hole here. That is not Gustavo in factory use needle to poke. It's done by a laser drill. You have to make sure every diameter has to be precise. So you're providing a micro environment here. So the pump continues to provide air, but because this is a laser drill hole, it provides some air coming out. And plus, this material has been proven with vapor permeable, so it offers some dryness in this area. So you're talking about this is waterproof, and then most of the this kind of design is that the headache for us, the nursing, I'm not nursing, but for you, is that you are afraid that the liquid, the liquid, the sweat or the urine, anything will go inside, right? So, but the majority of the 4-inch bladder is using buttons to click. So we think that is there's a risk because there will be room between this button and this button. So we use zipper to cover so that you prevent water going in. And then on the side, because we understand that in the hospital or in the ward, there may be a lot of people come and go. There will be like this, a cable going all around. So we designed this cable management. So something like that, you have the pump outside. The plug is always on the wall, right? But if you let the string come down, you can trip, you can hit and fall, crazy things can happen. So when we design this product, we try to stand in your position to think, what are some things that we can do to prevent that kind of danger? So this is a cable of management. So as you can see, this tube, this is nylon. It will be cooler than if it is not vapor permeable. You can lie on it. So you can see this tube pump is the same. It's very simple. Right here, it has weight indicator. Weight indicator. So let's say the lowest is 40 kilograms and the highest is 140. So it's easy for you to adjust. Rather than give you 1, 2, 3, 4, that doesn't make sense. So there's a relativity point for usage. But there's one thing that's very tricky, is that let's say one patient who is 70 kilograms, but his BMI is high, compared to another 70 kilograms where BMI is low. So if you lie on the bed and you just switch to relatively 70, can you just go? Why? Everybody why? The answer is no, obvious. But why is because you may have different body mass distribution. Some people are a little bit chubby here, some people are chubby here. So I'm not sure if you try to use this mattress, it offers a better pressure distribution, but you have to make sure that the patient doesn't bottom out. So the way you check is when you lie, you open this, and the patient's buttock, the heaviest part, usually it's around this area. So the key is to offer the lowest pressure without hitting the hard surface. So right here, this is just a reference point. This is just a reference point. They may not need 70. They may need lower, but if you're given 70, it's still harder, right? So the key is the lowest pressure, but the buttock doesn't hit the hard surface. But how do you do? The easiest way is the application to lie down, check for this area, and put your hands inside. This is about your face.